Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Research links urinary incontinence to heart disease. A University of Iowa-led research team has found that urinary incontinence may be associated with a greater risk for cardiovascular disease in women. This research is published in the journal Preventive Medicine. Urinary incontinence, the loss of bladder control, is a common condition, especially in older adults. Previous studies have stated that it can affect between 38% and 60% of women. The researchers aim to find out whether urinary incontinence was linked to a decline in physical activity, which can lead to a host of healthy tissues, including greater risk of cardiovascular disease. In this study, the researchers analyzed medical records over 2 years from more than 20,000 female patients in the Hartford healthcare system in Connecticut. Of those patients, 5.4% reported through a questionnaire to have urinary incontinence. All patients were asked to rate their level of physical activity in the questionnaire. Diabetes drugs shows promise in Alzheimer's prevention, study finds. A study led by researchers in the University of Florida College of Pharmacy has found that a pair of popular glucose-lowering medications may have protective effects against the development of Alzheimer's disease and related dementias in patients with type 2 diabetes. In research is published in JAMA Neurology, the data showed a statistically significant association between a lower risk of Alzheimer's and the use of GLP-1 and SGLT2s compared with other glucose-lowering medications. According to the researchers, the findings indicated that the two drugs may have neuroprotective effects for people without diabetes and may help slow the rate of cognitive decline in Alzheimer's patients. Serena Jinchuan Guo, an assistant professor of pharmaceutical outcomes and policy and the study's senior author, said these findings may study explores how socio-economic factors shape eating habits through internal signals. Published in the journal Food Quality and Preference, the research highlights how physiological signals, particularly those transmitted via vagus nerve, interact with socio-economic factors to shape dietary behavior. The study involved 96 students from diverse socio-economic backgrounds who participated in a chocolate tasting session. In a controlled laboratory setting, each participant was presented with a plate containing 70 milk chocolate pieces and invited to sample and rate them at their leisure. Researchers measured each student's heart rate variability as a proxy for the activity of vagus nerve, a part of the nervous system that regulates appetite and digestion. The study's lead author explained, the findings suggest that while the vagus nerve plays a key role in transmitting signals between the gut and the brain, the extent to which these signals guide eating behavior can vary with one's socio-economic status. In contrast, those from lower socio-economic groups appear to show a weaker link between these physiological signals and their food consumption. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.